Good afternoon, everyone. Um, okay, just wait for this. So, very happy to talk to you about this. This is going to be just to, all of you are very experienced. I'm not a doctor, but I come with some experience in working with hospitals, both NGO hospitals, government hospitals, and quite a few private practitioners. And I will be sharing towards the end of my talk one such experience. So basically, in this session, we're not going to talk about how to raise capital or how to make your investment work, but more about how can you kind of tweak your cataract practice, tweak your eye care practice to ensure that you are able to maximize your return on investment, and how you ensure that the design of your system is around that. This is not a session on finance, but I want to remind you that you have to look at the drivers of your costs are both your direct costs and your costs on capital, but mainly we fail to look at utilization, which is really dependent on the patient volumes. Are we bringing in enough patients, and how much are we making? So this is a fine balance. How much can I charge a patient versus how do I ensure that what I'm charging is not holding back patients from entering my system? And then profitability is mainly the outcome. So we're going to be talking about different levers that we can use to ensure that we are able to maximize this profit. And hidden behind are majorly our fixed cost, our indirect cost. So how do you ensure that your volumes help you ensure that you're able to utilize the fixed cost that you anyway have sunken in? Okay, so how do you ensure that you're increasing patient volumes? We already heard about the sleeping costs, appointments. How do you ensure that you're able to manage your flow? How can you ensure that you're having enough strategies? It could be outreach, it could be branding, it could be a lot of social media ideas that will come up in several sessions today. Are we investing in that to ensure that patients come into the hospital, that patients walk into our hospital? This is very, very important. And like I mentioned earlier, high pricing does not necessarily mean more revenue. Think of it like a step that patients need to step on to enter your hospital. How high is that step? If I keep it low, more patients will come in. I have to be good enough to serve them. If I keep it too high, I'm going to get probably only the premium customers walking in, which is fine, but please remember that does not immediately translate to more revenue. Compliance to treatment. This is something I'm going to elaborate further later towards the end. We all bring in patients, but are we able to maximize the revenue from each patient who come in? And compliance, adherence, or uptake of treatment is key here. And also examining where our patients are not coming from. So this is a quick look at patients who come from, this is the number of patients. The numbers you're seeing are number of patients, new patients per 1 lakh population in a year. You can see very varied. This is, our hospital is located in Madurai, and you can see in the neighboring districts, even from Dindigul, from north, from other centers, we're getting it, but from this immediately adjoining district in the south, we're not getting that kind of patients. So examine where your patients are coming from, but also examine where they're not coming from. For example, Shroff, several years ago, this is how they were able to really track where their patients are not coming from. They were using PIN codes, a very clever way to look at patients are coming from and where they're not coming from. So they identified 2 PIN code areas where patients are not coming from. They started doing apartment camps, and this way they were able to greatly increase the number of patients from those areas after intervention. You can see how great that growth was. So it's very important to step back and look at where our patients are or not coming from. And also examining, again, we're looking at demand flows. So in the north of India, we've seen, when we worked with several hospitals, this is that has a very big effect on the hospital. So you can see this hospital we worked with had, in the winter, they were doing 85% of their surgeries. And for the rest of the year, 8 months, they're doing only 15% of their surgeries. By working on shifting their camps to the summer times, by improving their counseling, by changing actually the doctor's mindset that season not often affects. Of course, there are a few things when sweat and certain conditions it can affect it. But your paying clientele, there's no reason why they should wait for the winter. And you can see how they've been able to shift that to 55, 45% today. And this is very, very critical because you're actually losing out the rest of the year from the income that you can make. This is really a mindset that we have that we need to re-examine. And just quickly looking at our costs. Our fixed costs, these are costs that you are incurring regardless of the level of activity. So it's very important for you to look at utilization. So let's look at how we can address this. But also equally important is your variable costs. This is linked, this is the consumables, all of that, if you're giving incentives, what you're giving your incentives. So costs that vary with the level of activity. So how can you reduce that? So let's look at the drivers of fixed cost. Scale is an important driver. You're paying rent, you're paying salaries for your staff. How can you ensure that you're maximizing it? So investment in infrastructure in the size that are appropriate to your scale. Okay, and again, efficiency. Can we ensure that constantly we are being an efficient organization? So look inward, examine how your patient flows are. Can you keep them lean? Again, we looked at seasonal variation. Seasonal variation even during the day, mornings are very busy, afternoons are very low. How can you encourage more patients to fill up your afternoon slots? Things like that. And again, constantly looking for the staff productivity pattern. Do you give feedback to your doctors on their productivity, on your surgeons on their productivity? For your surgery time, especially if you're renting an OT, if you're sharing an OT, can you ensure that you're maximizing the productivity of your OP and OT? And again, drivers of variable costs. Can you examine your clinical protocol from a cost point of view? So cost engineering your clinical protocol, eliminating any unnecessary investigations and procedures that are done, and things that are logistics driven. Can you ensure that you have a very good inventory management? We've freed up a lot of investment just by fixing our inventory. Group purchasing for better practice, and these are several things that are done but not universally done. And very importantly, standardization can greatly reduce your variable costs. Not buying from too many vendors, not buying too many brands, really keeping your inventory more standard with a lower variation also gives you better buying power and also helps you manage your costs. You can keep your inventory low also. And again, appropriate pricing helps you increase your revenues, because of increased patient flow. So even though your costs are low, because of the scale, your utilization improves as well as your revenues improve over time. And all of this without compromising quality. In fact, more and more patients will come in only if you keep your quality up, as we've heard several of the speakers before us say. Patient experience is so important. I've mentioned this in one of the earlier talks here. I'll just take a couple of minutes more. So this is a patient who had a very bad experience. He had to come 3 times just to complete his retina visit. So this is something that we really need to examine. What is our patient undergoing? These are the leaks that our patients experience. 2 minutes. So examine, ensure no appointments, because this helps you to, this is what the West is now going towards, on-demand care they call it. So when you go into a grocery store, you can go in any time. You don't need an appointment. So can you examine that? No waiting lists. Basically, when we say no appointment, no waiting list, we're removing one barrier for our patients so that they can come in freely. So ensure that you're completing the care in a single visit. You're completing the care cycle at an appropriate level. They don't have to come for a pair of glasses. They don't have to travel to a tertiary center. I'm going to just quickly wrap up with this one story. I'll just take a minute. So this is a hospital that we worked with in Tamil Nadu. They were already having, you can see, a very decent acceptance rate. So if they advised 100 patients to undergo surgery, 68 of them were undergoing surgery within the month, which is, to our extent, this is what we keep as a benchmark, 65%. But they wanted to increase this. They wanted to see if there was any leak. So we worked with them for a year, and you can see their advice rates. We examined their counseling rates. Patients were not making it to the counselor's desk. So they were we worked on improving their data capture, their quality of communication, the patient satisfaction. Every single cataract diagnosis entered in the hospital management system with less than 618 vision was captured as a potential advice, and we wanted to see how many of them actually made it to the counselor. So manually it was maintained. They were all fast-tracked through a special cataract clinic was created. And most importantly, they ensured that whenever anybody, most of them were dropping out because of systemic fitness required. The hospital could not afford their own physician, so they tied up with a local physician and ensured that they were seen quickly. So patients were escorted and brought back. They plugged that one hole, and through also fixing their data, fixing their flows, they were able to they had not increased their outpatients, but you can see how they greatly increased their surgeries that year. So I want you to really examine where your patients are leaking, what is keeping patients from entering your system, and where they're leaking out, and ensure that you're able to maximize the return on investment for every patient who comes in. Maximize your return on investment for every rupee you put in. So thank you. I'll leave you with these points.
Thank you very much for a very, very lucid presentation. Now, the question that arises is, does the ophthalmologist need the patient or the patient needs the ophthalmologist?